Covered entities and business associates must adhere to state and federal retention and destruction requirements. In this section, we will explore the retention and destruction requirements for HIPAA information. There is no medical records retention period under the privacy rule. Although there are no HIPAA retention requirements for medical records, there are requirements for the retention of other HIPAA-related documents. Those documents include privacy practice notices, authorizations for PHI disclosure, risk assessments and risk analysis, disaster recovery and backup plans, business associate agreements, information security and privacy policies, employee sanction policies, incident and breach notification documentation, complaint and resolution documentation, physical security maintenance records, logs recording access to and updating of PHI, IT security system reviews, including new procedures or technologies implemented. Even though HIPAA does not require retention on medical records, there are laws regarding retention in Washington State. Washington State defines medical records as records created by the Public Health Agency on a per-client basis to document healthcare services provided to clients. This includes, but is not limited to, clinical assessment and treatment records, medication administration records, client treatment history and treatment summaries, and dental records. SRHD is required to keep adult records for 8 years after the last date of service. Children's records must be kept for 8 years after the last date of service and 3 years after they attain age 18. Per Washington state law, SRHD is required to retain other medical-related types of documents for various periods of time. Some of those document types are case and contact registers for tuberculosis and STDs, burial, cremation, and transit permits, WIC documents and processes, epidemiologic investigations and reports, foodborne illness investigations, counseling, radiologic reports, animal bites and treatment, inmate medications, HIV test reports, and many more. If you have questions regarding medical-related retention, contact the HIPAA Privacy and Security Officer or the SRHD Records Officer. HIPAA requires covered entities to shred, burn, pulp, or pulverize paper records so that PHI is rendered essentially indecipherable. At SRHD, you may only put PHI or PII in the provided shred bins or use a crosscut or microcut shredder. For PHI on electronic media, HIPAA requires the use of one of the following: clearing, which is the use of software or hardware products to overwrite media; purging, which involves degaussing or exposing the media to a strong magnetic field; or destroying the media, which consists of disintegration, pulverization, melting, incineration, or shredding. At SRHD, the appropriate method is determined for each situation.